So I restored motion on the first rib on both sides, and now we have good spring mobility. Okay. I did not treat T1 directly, but this should be T1 here. The other should be 2 and 3, and that all moved well, and this should be 7. And now I feel a depression into your neck, so that's probably 6. So all of that is now moving. The AC joint now, I can push it posteriorly and take up the slack, and I spring and it recoils right back. So that motion is better. Oblique motion at a 45-degree angle through the shoulder girdle, including the acromion, is better. And I did not treat her upper cervical by simply restoring the bilateral rib mobility, and the first thoracic motion was restored indirectly. And now, when I spring the transverse process of C1, see there's a lot of movement now. I can spring it to the right. I can spring to the left, pushing on the right side of the transverse process of C1. I can easily lift your head up. Okay? And when I come and open that space back there, I can spring C1. And when I put you in extension, taking up the slack, and I see the movement through the lower body, but now we have spring mobility. So the mobility is much improved, and again, that was a reflex release of the atlantoaxial joint, which was kept in hyperextension by a reflex. And the secret is treat the bottom of the lowest denominator of an injury. Don't treat the compensation, and the compensation was hyperextension in the upper cervical. But again, that was driven by the nervous system, and I can't override the nervous system. So an interesting presentation, and thanks for letting me film it.